So we're going to talk next about sucking need and about teething in infants. Sucking is a strong physiologic need in infancy, and it's not usually completely met by feeding. Sucking is soothing to the child. So not only does it provide nutrition, it is soothing. Parents a lot of times become concerned about either thumb sucking or getting dependent on a pacifier. There's pros and cons to each, and realistically, often the child decides. You can try to give a child pacifiers, but they may knock the pacifier out and choose their thumb anyway. So some of the things to know about each: pacifiers, if they're given before breastfeeding is established, they actually can be associated with decreased breastfeeding. So if a parent is if breastfeeding is very important to them, this is one of the things that we can let them know. I wouldn't ban pacifiers for breastfeeding parents, but I would let them know if breastfeeding is important to you, then giving the baby a pacifier before your milk supply is well established can actually decrease milk supply and decrease breastfeeding. Pacifiers are associated with an increased risk of ear infections, but a decreased risk of SIDS. Sucrose pacifiers are used for analgesia during some procedures. We really want to tell parents, don't make your own pacifier. Homemade pacifiers are discouraged because they're often a choking hazard, and routinely coating pacifiers with a sweet substance is not a good idea, because it gets them used to, for one thing, always having the sweet taste, but also it causes tooth decay. Even before the teeth begin to come in, they can start to have problems. Thumb sucking, one of the benefits or one of the drawbacks is you can't take it away. Pacifiers can be taken away if the child's dependent on a pacifier. You can't take their thumb away, but also they can't lose it. So when they are in that phase where they really need it to go to sleep, you can't find. I've been the parent at Walmart trying to find the right pacifier at bedtime because we've lost them. So you can't do that with a thumb. It can't be lost typically. So there's pros and cons to that. It can persist into school age years. Typically, as kids get older, they decrease how much they're sucking thumbs. They might still do it at bedtime as they get older. If they're sucking their thumb past the age of about 4, then it's more associated with moving the teeth, with dental malocclusion. So those are some of the factors parents might want to consider. Teething usually begins around 6 months of age. The general rule is an age of a child -2 is about the number of teeth. So after 6 months, we look at that rule. Kids may be irritable, fussy, and have loose stools from excess saliva. They may have increased sucking, mouthing, or biting. Often breastfeeding parents, when the kid starts teething, they're being bitten. So just some parents choose to wean at that time, but if they don't want to wean, there are other things that can be done. A baby cannot breastfeed and bite at the same time. So if they start to bite, then they can be removed from the breast, put down, sorry, we're done nursing right now. They learn pretty quickly that they don't get to nurse if they're biting. But when the baby is teething, we would recommend that mother who wants to continue breastfeeding just watch them really closely. And if they seem like they're finished feeding, go ahead and take them off the breast at that time. Fever, vomiting, and diarrhea are a lot of times assumed to be because of teething, but actual fever, actual vomiting, or actual diarrhea are not due to teething. It's not unusual to have a little bit of loose stools and not feeling good, but any of those symptoms are not teething. Pain management for teething: cold is helpful, pressure is helpful, so teething rings can be really helpful. Topical anesthetics can be used, but they tend to only numb for a couple of minutes. And if you read the directions, they can't be used that frequently. If they're used too frequently or they're getting too much of that, it can cause methemoglobinemia. So it can cause some blood, a blood disorder. Also, an old remedy for teething was to rub whiskey on their gums, and we obviously have to recommend against that. Systemic analgesics like Tylenol or ibuprofen should not be given for more than about 3 days. And they're teething a lot of infancy, so we recommend that they limit that use, that they are not taking Tylenol and ibuprofen every day in infancy. So that should be for days that they just can't get comfortable in any other way. We recommend parents to begin taking care of teeth and gums early with a soft washcloth and no fluoride toothpaste. Once they begin brushing their teeth as toddlers, they still should be using toddler toothpaste without fluoride until they're reliably not swallowing the toothpaste. The other thing about teeth is sleeping with a bottle that contains anything but water contributes to a very specific pattern of tooth decay called baby bottle caries. And it is really not recommended. We don't recommend they do it even with water because it may keep dripping and they can aspirate. But if there's anything except water in that bottle and they're asleep, it pools around the teeth and causes tooth decay. Okay, next section, we're going to talk about nutrition.